Hi everyone, my name is Dembo Omadjela, and then today I'm going to be talking about urinary tract infection in children. I did my pediatric rotation at Rappahannock Regional Health Center. So I had a patient, 3-year-old female Hispanic, that came with mother, and then the chief complaint is pain when I pee. HPI. For HPI, the patient presented with mother. Um, and she had a chief complaint of pain when she urinates, and her symptoms started 2 days ago. The mother noticed that the had strong odor, and she had nighttime enuresis, one-time episode. And then the mother said that she was complaining of pain, stomach pain, as well as abdominal pain over the bladder area. The pain doesn't radiate and it's constant throughout the day. And she states that the pain is 5 out of 10 and it doesn't get aggravated. It gets aggravated or it's aggravated by urinating. The mother states that she doesn't hold her urine for a long period of time, um, and she didn't give her daughter anything as far as over-the-counter medications, and she had no history of Bible bath, and she doesn't think her child is constipated. Per mother, there was no other associating symptoms such as fever, nausea, and vomiting. For past medical history, she had one-time urinary tract infection, which started this year, and she was treated with Keflex, and she's not on any current medications. And for allergies, she's allergic to fish, which she gets when she eats fish, her face gets swollen. But she has seen her allergist, and she has an EpiPen for it. For objective findings, she looked alert, well nourished, well hydrated, with no acute distress. Her vital signs were within the normal limits. She didn't have any temperature, but she's overweight. Her BMI is 94.6 to 4. She had no skin lesion, no rashes anywhere. We did her hemoglobin was 12.5, which was normal, and we also did her lead. They also did her lead last year, and it was 0. Her her cardiac assessment were fine. Her heart rate and rhythm was within the normal limit. She had no gallop, no murmur. Her chest wall was with any noted deformities, and also with her respiratory, there was no any wheezing or any other abnormality with her respiratory assessment. Her chest rises and fall equally, and for her abdomen, all the bowel signs were heard in all 4 quadrants. No tenderness or distension noted. I wasn't able to palpate any masses or hernia. And for her genitalia area, she had a normal female external genitalia, but her vulvar area where it was a little bit red, but no discharge or lesion noted. Her skin or general skin overall revealed no significant rashes. For diagnostic, we did urine dip, urine analysis, and also urine. We send the urine for culture, and then also my preceptor order renal ultrasound. For her urine culture, it came back. It grew Proteus mirabilis greater than 10,000 colony, and then also the urine analysis showed 3+ leukocytes, X-rays, and 1+ of bacteria, and her pH was 5.5, and specific gravity was 1.024. For our differentials, we had acute pulmononephritis, which is characterized by fever, flank pain, dysuria, polyuria. Patient may experience nausea, vomiting, and then on the physical examinations, patient may appear toxic. Usually, they have CVA tenderness, but given the symptoms in the physical examinations, the most likely diagnosis is not polynephritis. My second differential is nephrolithiasis, which is when presented in children, we have variable, or it depends on the age of the patient. The patient might have severe colicky, abdominal pain. They might present with non-specific symptoms like abdominal pain, nausea, vomiting, or they might be irritable, and also they might have a gross hematuria. And in patients younger than 5, kidney stones are frequently discovered following urinary tract infection. My third differential is gastroenteritis, and the signs are diarrhea, vomiting, increase or decrease in urinary frequency, abdominal pain, um, fever, sore throat, cough, and also the child might be irritable, lethargy, as well as changes in amount of frequency of feeding, and also in the level of a child thirst. But based on our physical exams and the diagnostic, this we came up with a diagnosis of UTI because the child had burning sensation when she pees, strong and persistent urge to urinate. She was passing small amount of urine. Her urine appeared cloudy. She had a strong smelling urine, and also pain over her pubic bone. And for our plan, we prescribe medication called Augmentin, 6.3 PO/PID twice a day for 10 days. And we educated the mother on washing genital area with water and not using bubble bath because it's extremely irritating. Wiping the child from front to back, especially after stooling or after bowel movement. Making sure the child is not constipated, encouraging the child to drink enough fluid, and also encouraging the child to urinate, not to hold their urine, and also to have her wear loose cotton underwear. And after we educated her, we prescribed the antibiotics, and then after 48 hours, one of the staff member called to make sure that the medication was working. And based on our culture result, the antibiotic that we prescribed, it was sensitive enough, so the child was responding appropriately to the treatment. If she wasn't responding appropriately to the treatment, we would have considered to do further evaluation, like more like laboratory study, more imaging, or maybe even consulting another specialist. For reflective practice, we prescribe Augmentin, and looking at the literature, it is sensitive. Um, it is sensitive, and it is the one that's preferred to get treated for infants or children who has UTI. And other choices are Caflex, um, Cefismine, Cefazil, Cefazil, and then it's all in the cephalosporin class. And also for reflective practice, we did an ultrasound because this was her second time having a UTI. And according to the literature, ultrasound of the bladder and the kidney is recommended for infants with fever UTI to exclude any structural abnormality or to detect hydronephrosis. And this is a really nice chart to look at. It tells you when to get an ultrasound based on the child's age, as well as if they have temperature or not. And here is my references. Thank you.